Fibrosis is nothing but deposition of collagen along with the deposition of extracellular matrix. Then this is known as fibrosis. Actually, normal deposition of collagen is present in the normal wound healing. But fibrosis is a special thing where there is deposition of both collagen and the extracellular matrix. So we know the scar and fibrosis are used interchangeably. They are nothing but the same meaning, because the scar formation is mainly because of macrophages, fibroblasts, many other cells, and below the scar formation there is a granulation tissue, that is pinkish color tissue. So whenever there is a wound, you can observe the first layer is nothing but the scar and the second layer is the granulation tissue. So in both this granulation tissue and the scar, there is neovascularization, that is formation of new blood vessels. These new blood vessels are formed to provide the nutrition for them. So first we need to understand this before understanding the fibrosis. Actually, this fibrosis is mainly due to the deposition of collagen, especially in the chronic diseases. So that is important. But whereas scar can be also formed in deep wounds, etc. But this fibrosis takes place mainly in the chronic diseases because of persistent stimulus, that is long-term stimulus of an injury. That is because of this. And the short-lived stimulus triggers only the steps of wound healing. In like injurious stimulus caused by infections, autoimmune reactions, trauma, and also other types, even severe organ dysfunction, this is all because of leading to fibrosis. So the persistence of injury leads to a chronic inflammation and proliferation activation of the macrophages, lymphocytes. So these macrophages are also stimulated in a different way, that is by alternative pathway, not by normal pathway, because we know macrophages are the one which are having mainly the microbicidal activity but not in this fibrosis process. But macrophages play also role in fibrosis process when they are activated by an alternative pathway. So what is that we are going to learn. And also the lymphocytes of course are activated, and production of pleiotropy of inflammatory fibrogenic growth factors and also cytokines. So let us see this to understand. So the persistent stimulus of any chronic inflammation, activation of the macrophages and lymphocytes. So this in turn activates the growth factors like PDGF, FGF, TGF, beta. So when these are activated, they lead to the proliferation of mainly fibroblasts and also the endothelial cells and the specialized. So endothelial cells are proliferated in the neovascularization, that is the newly formed endothelial cells are proliferated. So that leads to the gaps between the both endothelial cells, and they are more leaky because they are newly formed and having more gaps, so they are more leaky. And also the specialized fibrinogenic cells. Why these are all? To form the fibrosis. And this nothing but the next cytokines involved are TNF, that is tumor necrosis factor, interleukin 1, interleukin 4, interleukin 13. These are important to increase the collagen synthesis. So when the collagen is increased, it leads to fibrosis. And decrease metalloproteinase activity. So what is this metalloproteinase actually? It is a protein which is used to break down, not only the scar formation is important but also breakdown of that components is important, because whenever the wound healing has completed, then we need to remove it. So to remove that, we need this metalloproteinase activity. But here to form fibrosis, first we need to inactivate this, and later we need to activate it whenever the wound healing has completed. So first in the first phase to form the fibrosis, this should be decreased, that is decreased collagen degradation. So again leading to fibrosis. So first we need to understand this concept. And next we have here one more flowchart, that is injury. If injury is leading to the cellular and vascular response, we know that is new vascularization is forming, new cell scar is forming. So it is divided into the stimulus removed acute injury or persistent tissue damage. Just now we understood if it is persistent for long time, it is forming fibrosis or also known as tissue scar. So examples for this are chronic inflammatory diseases like cirrhosis, chronic pancreatitis and pulmonary fibrosis. But if the stimulus removed, that is only in acute, here the chronic injury, here the acute injury only for some time, then it is again divided into based on parenchymal cell death, that is intact tissue framework, only superficial wounds, only light wounds with only some inflammatory process, then it leads to regeneration, that is restitution of normal structure. Examples you can take liver regeneration after partial hepatectomy, or superficial skin wounds and resorptions of exudate in the lobar pneumonia. So all these are for regeneration. So when something wound which has gone the stage of regeneration, that is it no more can't regenerate, then it goes to a process of repair. Here repair is nothing but scar formation. So you can understand scar formation and fibrosis are somewhat similar, because here it is taking place in the deep wound but only for acute injuries, but if it is for chronic injury long term, then fibrosis. So here repair is scar formation. Examples: deep excisional wounds and myocardial infarction, there the scars are formed. So let us understand this. So first, the macrophages are activated. These are effective mainly in ingesting the destroying microbes and dead tissues. We know that is mainly for microsoluble activities. But instead, these are functioning now as remodeling the tissues and promoting the angiogenesis. Remodeling the tissue means changes in the tissue, because now it is a wound area, so we need to remodel the tissue and also promote the angiogenesis and scar formation. So the cytokines which induce the classical macrophages, that is the normal macrophages for the microbicidal activities, those are mainly the Th1 cells, that is T helper cells 1, and notice will be that is the IFN gamma factor and also tumor necrosis factor. Whereas the alternate macrophage activation, that is for the scar formation or in repair, these are mainly induced by interleukin 4 and interleukin 13. So this is important. Interleukin 4 and 13 are the main factors which are inducing the alternative macrophage for our fibrosis formation, and also this is by Th2, that is T helper cell 2, with also including mast cells and eosinophils. So alternatively, activated macrophages produce this factor, that is TGF beta, and also other growth factors that are involved in repair process. So this is important. These are activated by interleukin 4, interleukin 13 and by Th2 cells and also mast cells, eosinophils, and they produce the TGF beta, that is a growth factor. So because what is this TGF beta now? It has produced. So what is doing? We need to know. So what is doing? This TGF beta is an important fibrinogenic agent that is forming fibrosis. So it is mainly produced by most of the cells in granulation tissue. So first the scar is formed and inside a pinkish tissue. So that granulation tissue is mainly it's present in this granulation tissue and causes the fibroblast migration, proliferation, increased synthesis of collagen, fibronectin, and decrease the degradation of ECM, because due to inhibition of metalloproteinases. We have understood this. So the levels of TGF beta in tissue are not primarily regulated by the transcription of the gene, but they are dependent on the post-transcriptional activation of the latent TGF beta. If you remember, this TGF beta is mainly dependent on the post-transcriptional activities. And next, in most cases, such as in lung, kidney fibrosis, myofibroblasts, already discussed in our old chapter before, so are the main sources of the collagen. But the stellate cells are major collagen producers in the liver cirrhosis. Only in the liver the stellate cells are important, but the myofibroblasts are, in the most cases, the myofibroblasts are the important source for the collagen. So these are also produced in the granulation tissue and also the scar formation. So the important role of osteopontin, this is one more thing which is also used in wound healing and fibrosis. So this osteopontin is expressed in the fibrosis of a heart, lung, liver, kidney and also other organs. So sometimes we have done an animal experiment where the blockage of this OPN led to the expression during wound healing, decreases the formation of the granulation tissue and scarring. So we have found that this OPN is important for the granulation tissue formation and also scarring. So although these mechanisms by the OPN promotes the fibrosis and not completely understood till now. So this OPN is a mediator of the differentiation of the myofibroblasts induced by the TGF beta. So this TGF beta is also OPN is a mediator of the differentiation of myofibroblasts induced by TGF beta. So this TGF beta is also inducing this OPN, which is also useful for the scarring and also granulation tissue formation. So contrast to wounds in adults, the fetal cutaneous wound healing is without scar formation. So this is important point. In adults there is scar formation and healing, but in fetal cutaneous wounds are mainly without scar formation. And several factors have been proposed to promote the scarless healing, including the non-fibrinogenic forms of TGF beta, here also TGF beta but non-fibrinogenic forms, and also lack of osteopontin there and the absence of Th2 response. So this is all leading to scarless formation, scarless healing in infants. But there is no definitive results have been obtained till now. So next, the serious organ dysfunction produced by fibrosis is a major effort to develop the clinically useful anti-fibrinotic agents. Amongst these agents being tested are the inhibitors of TGF beta. So whenever if there is a serious organ dysfunction, like because of mainly fibrosis, then it is we found that is because of low inhibition of TGF beta. So some agents are inhibiting the TGF beta, which is leading to fibrosis and organ dysfunction. So this TGF beta is an important factor. Or also signaling angiogenesis inhibitors, and also toll-like receptors antagonists, and the decoy receptors, that is IL-3 alpha 2, which blocks the interleukin 13. So what happens whenever this all interleukin 13 or TGF beta, all these factors are decreasing, it is leading to organ dysfunction, that is serious organ dysfunction mainly produced by the fibrosis. So the fibrotic disorders are mainly in the diverse diseases, causing diverse diseases like liver cirrhosis, systemic sclerosis, fibrosing disease of the lung, that is idiopathic pulmonary fibrosis or pneumoconiasis, and also drug radiation induced pulmonary fibrosis, and also leading to chronic pancreatitis, glomerulonephritis, constrictive pericarditis. So these are the conditions which are leading to all this. So whenever there are decreases, so this TGF beta is an important growth factor which is required for the fibrosis of a tissue. So this is all about fibrosis.